Hey everyone, welcome back to the channel. Today we're diving into a topic which has been hotly debated for years. What drives insulin resistance and diabetes, and does sugar do that? You've probably heard that claim before. I know that I used to state that claim when I was carnivore, that anybody eating sugar was going to get diabetes. So let's dive into the actual science on blood sugar regulation and the hormones that affect it. Stick around because this is probably going to surprise you. First, let's tackle the common belief that sugar causes diabetes. It's a statement that you've likely heard countless times. But is it true? Well, not exactly. The relationship between sugar and diabetes is really complex, and it involves a lot more than just the sugar that you eat. I think commonly this idea is kind of a Neanderthal conclusion because we typically diagnose diabetes by someone's blood sugar or how much their red blood cells are glycated with their HbA1c. And that can usually determine what their average blood sugar has been over the previous 3 months. Well, if you're judging if someone has diabetes by how much sugar they've had in their blood over the previous 3 months, it would be very simple to go, well, if they have a lot of sugar in their blood over the last 3 months, it must be the sugar that causes diabetes. To understand this a bit better, we have to dig into the hormones, specifically insulin and glucagon. These two hormones produced in your pancreas are really the key to regulating your blood sugar. Insulin is released in response to eating when your blood sugar starts to go up or is high, and that fundamentally is trying to pull your blood sugar down by pushing the sugar in your blood back into your cells. Glucagon, on the other hand, is released when your blood sugar gets too low, and it signals to your liver to release its stored sugar into your blood so that you can raise your blood sugar levels back up. In a metabolically healthy person, insulin and glucagon work together like a yin and a yang to try and keep your blood sugar at a healthy but stable range in your blood. But in diabetes, this balance is completely disrupted. And there are two main types of diabetes we probably should cover. Type 1 diabetes is where your immune system attacks your pancreas so that you actually cannot produce enough insulin to move blood sugar around your body in the way that you want to. It really has nothing to do with your diet and is fundamentally driven by genetic and environmental factors. And type 2 diabetes, which is far more common, is different. It occurs when your body starts to become resistant to the insulin that is signaling for your cells to take up the glucose from your blood. And so your pancreas is struggling to make even more insulin to get that glucose back into your cells. And this leads to higher and higher blood sugar levels over time. It's not necessarily that you aren't even reducing insulin. If you look at someone with type 2 diabetes, typically they have a very, very high insulin. It's fundamentally that the cells are not listening to the insulin to take up the sugar from the blood. And so you can kind of start to piece this picture together. Is it the sugar that drives diabetes, or is it that your cells are ignoring the insulin, signaling that they should take up the sugar from your blood? So where does sugar fit in? It's pretty clear sugar itself does not drive diabetes by this understanding of the mechanisms. Now here's the tricky part. Modern allopathic medicine will tell you consuming a lot of sugar in high volume will drive insulin resistance and diabetes. But the truth is that no one is ever really just eating sugar in isolation. If you're drinking a Coke, you're usually drinking a Coke whilst eating chips or fries or cakes or something else. And this is why you're actually seeing a lot of people who choose to do sugar diets or this new kind of sugar fasting trend can lower their fasting insulin and lower their fasting glucose. By eating almost a pure sugar diet, you're clearing out the other things which might block the insulin signaling to your cells. In a previous video on my channel, which I would recommend everybody check out, I dug into the science about how protein can actually cause insulin resistance, specifically the BCAAs in protein, especially if you're suffering from obesity. On the flip side, if you are insulin resistant or you have type 2 diabetes, it's now becoming pretty common that people recommend you go on a carnivore diet or a high-fat keto diet to solve that. I do know people who have tried to do that and they have not found success. In fact, I've gotten in trouble before with some academic staff at a university that I won't mention when I was asked on an exam if a low-carb diet could be helpful in type 2 diabetes treatment, and I refused to answer no. The truth is that there are probably a million individual factors that come down to a person and their insulin resistance. And for some, a high saturated fat diet will work wonders. Actually, removing sugar from the diet will reduce their insulin resistance and let them kind of burn free energy. And on the other hand, sometimes that doesn't work. You have to actually move to more of a mono diet on the sugar side or on the carbohydrate side. What we do know is that acutely, when you eat carbohydrates and something else together, protein or fat, you can make yourself quasi-insulin resistant because you're confusing your cells. There's lots of signaling going on. And that if you want to induce diabetes and insulin resistance in mice, the number one thing you do is you feed them high linoleic acid diets. That's polyunsaturated fat, typically found in seed oils. That is the gold standard in science, that you feed mice soybean oil to make them diabetic. So let's circle back to hormones. There are other hormones like epinephrine and cortisol, which can affect blood sugar, especially when you're under stress or when you wake up. In type 2 diabetes, the insulin resistance really messes with this entire system of hormones because the key hormone of action, insulin, is not being listened to. So the yin isn't being listened to and the yang is still kicking in, and you get very, very confused. The recommendations around diet and exercise are usually pretty common sense based, but fundamentally the idea is that the more muscle you have, the more blood sugar you can pull out of your blood, or the more sugar you can pull out of your blood into that active tissue, thus keeping your kind of balance in your actual blood sugar levels. At the same time, there are many people that I personally know and have interviewed on the Patchwork podcast who were doing not a lot of exercise and managed to get their metabolisms up to 4,000 or even 6,000 calories a day, eating almost purely sugar-based diets, and they weren't doing that much exercise. Again, a diet free from the polyunsaturated fat linoleic acid can really let your body burn fuel very cleanly and keep your cells insulin sensitive. The bottom line is that sugar does not cause diabetes or insulin resistance. Excessive consumption can contribute to risk factors like obesity and type 2 diabetes. That is what the science says. It can contribute to these risk factors, but there isn't a common sense or even well-argued mechanistic system that means that sugar would drive diabetes. Now, if you eat a high sugar diet, yeah, okay, there are other issues. You might be micronutrient deficient, you're likely going to be choline deficient, your teeth are going to get absolutely hammered, but you don't have to worry about diabetes specifically. If you haven't seen my video on how we actually make energy, I would highly recommend you check it out. Something to be aware of is that to make energy from carbohydrates, there are a number of cofactors that you need. Same with fats, but they're different cofactors. And usually people on a high sugar diet very quickly become thiamine deficient, which is vitamin B1. When you become thiamine deficient, you can get a disease called beriberi. It's well documented. This is why we add thiamine to refined flours in the US when we make bread. So I don't want you to take the message away from this video that you're eating a high sugar diet and everything's going to be fine. Definitely have a conceptual awareness that you're eating a micronutrient deficient diet, even if you're just eating fruit. If you're doing a pure sugar diet, you are going to be hammering your liver, and you might want to be thinking about the nutrients that your liver needs to recover from the stress you're putting on it. That's different forms of choline and even potentially DHM. So thanks for watching. I hope this video cleaned up some of the confusion around sugar and diabetes. Again, sugar doesn't cause diabetes. However, a full always sugar diet is devoid in other nutrients, which are going to cause you health issues long term if you're not aware of them. If you found this helpful, make sure you like, subscribe, and hit the bell icon so you get notified in the next video. And I wanted to take a second to talk to you about Patchwork. Now, at Patchwork, we actually built first of its kind functional medicine inspired metabolic health coach using AI. You can check it out at coach.patchworkfood.com. It's free to use. The coach will talk to you and ask you a bunch of questions trying to diagnose your underlying metabolic issues, usually flagging that your metabolic rate isn't where it should be, and then working with you to build a 10-week plan on how to get you where you should be. So let me know in the comments, what other health myths would you like me to clear up or even help you understand? I'll see you next time.